Hello, this is Dr. Vaibhav Chavan. Today I am going to present a case of frontal glioblastoma in 86-year-old male. So you can see this is a contrast enhanced MRI. You can see in the left frontal region, this is huge tumor. It is a solid as well as this is cystic component, this is solid component. It is anterior posteriorly almost 8 centimeter by 8 centimeter huge tumor. This tumor is almost near to the internal capsule and basal ganglia region. It is very near to the ventricle also. See, this is a huge tumor. So we have operated this patient. There are three key points to remember while during the surgery. Usually during the oncosurgical principle is that you should remove the entire tumor and the margin should be clear. But in neurosurgery, we try to preserve as much as function possible. Of course, at the maximum safe resection is the principle of neurosurgery. So that's what we have done. We have removed maximum tumor with preservation of all the functions. So there are three risks involved. As you can see, this is very near to the internal capsule. So there is a risk of hemiplegia. It is very near to the ventricle. So if the ventricle gets opened, the post-op morbidity will increase. And as in the sagittal as well as coronal images, you can see it's the tumor is in the frontal, inferior frontal, middle frontal region. It's very near to the Broca's speech area. So patient has post-op likelihood of hemiplegia, loss of speech, aphasia, and as well as morbidity, mortality. So we have operated this patient and we are able to preserve all the three functions, and we have done a maximum resection. Let's have a look at the post-op CT scan. Immediately post-op CT scan, as you can see here, this is we have entered the tumor through the inferior frontal gyrus. We have removed done a maximum safe resection. This is a resection track. The cystic component as well as most of the solid component is removed. You can see here you can see appreciate the post-op edema, which is present usually during the glioblastoma surgeries. There is a reduction of midline shift, there is a reduction of uncal herniation, and post-op we are expecting brain swelling to increase, so we have removed a bone flap. Removal of bone flap also helps to avoid the brain swelling if a tumor recurs and during the future radiotherapy. So we have done almost maximum safe resection, and post-op neurology is also preserved. Thank you very much.